Knock, knock, knock. Hi, I'm Rachel. I'm going to be your student nurse today. I'm going to go ahead, if there's a curtain, I would pull that to ensure patient privacy. Can I go ahead and get your full legal name and your date of birth? Okay. While I'm doing this, I'm also going to find their wristband and check it. I'm also going to ask about allergies. Do you have any allergies? And this patient does not have any allergies, which is great. So then I'm going to go ahead and assess for level of consciousness. So do you know where you are today? Okay, who's the president? So I've assessed for all of this, and this is where, I'm getting my bed up to a safe working height, but I'm going to ask my patient about their primary complaint, why they're here, and then I'm going to target my questioning using cold spa. So I'm going to ask about when did the pain start, where is it, how would they characterize it as like sharp, dull, throbbing, stabbing, if it moves anywhere, ask if anything makes it better or worse, ask how long it's felt this way, ask if they've ever felt anything like this before, etc., and asking questions and kind of letting the patient also volunteer information. We also want to ask again about what makes it worse or better. Then the next thing I'm going to do is I'm going to ask about their own medical history and if they have any diagnoses, their surgical history, any medications they're taking or medications they should be taking, also herbal supplements. And you also want to ask about their family and their family history. I'm also going to ask about alcohol use, drug and tobacco use. You also want to ask about their exercise and their diet, what does their normal food intake look like. You also want to ask if they feel safe at home. So once you also want to assess for pain before you really get any further in your conversation. Okay, so the first thing I'm going to go ahead and do is, as I've been talking to my patient, I've been assessing the general demeanor, is I'm going to check for symmetry in their face and torso. I'm going to ask them to smile for me and grimace and scrunch their eyes up. First thing I'm going to say is I'm going to shine a light in your eyes, so it's going to be twice in both sides. Okay, so checking for pupil symmetry, and twice, and then I ask them to follow the tip of the pen with their eyes for checking for accommodation. And then if you want to open your mouth for me, I'm going to take a peek, shine a light in there, look at the mucosa. Okay. The next thing I'm going to do is I'm going to grab their hands and ask them to squeeze my fingers. So we're testing plexus, and then I'm also going to take extremity temperatures with the dorsal surface of my hand. I'm going to check for radial pulses and also check for capillary refill and skin turgor. Okay. So the next thing I'm going to do is I'm going to sit my patient up, which they're kind of in a pretty good spot. I'm going to pull their gown down and let them know that I'm doing this. Okay. Okay, and I'm going to assess the chest. It looks nice and symmetrical. Look at their breathing pattern. I'm going to palpate, let them know that I'm touching them. Let me know if anything hurts. Just feeling around for some crepitus, and then I'm going to go ahead and listen to their chest. Now, depending upon where their current issue is, I'm going to ask some follow-up questions, you know, about chest pain, kind of pain with breathing, etc., if they're coughing anything up. I want to listen for a full breath cycle at each spot. Okay. Next thing I'm going to do is I'm going to listen to their heart. And then I'm going to listen again with my bell. Okay. Got that part. I'm going to pull their gown back up, and then I'm going to sit my patient up. And this is a great time to have a tech help you kind of protect their head. You're just going to sit them forward. I'm going to palpate their back, check for any crepitus, and then ask them to take a nice deep breath for me because I want to see my thumb spreading. And the next thing I'm going to do is I'm going to listen to their back. And again, for a full breath cycle each time. Okay. The next thing, I'm gonna sit them back down. And then I'm gonna go ahead and lay them all the way down. This bed is not very cooperative. Something stuck in here maybe. There we are. Alright, so I'm gonna lay them all the way back down. I want them to get them completely flat. I'm gonna pull their blankets down and their gown up. We're gonna try and preserve privacy. I'm gonna take a look at their belly. I'm looking for any pulsing or distension. I'm gonna ask them about whether they've been passing gas in their last bowel movement. And I'm gonna listen in all 4 quadrants. And I'm listening for gurglings and bowel sounds. I'm also gonna let them know if anything hurts. Again, they should let me know. Listen to all 4 quadrants, and then I'm gonna go ahead and gently palpate, and I'm checking for distension and guarding. This is also, forgot to do this, I should have done this earlier. This is also a good time to check for bruise with your bow. Okay. Done this. Okay, so you cover your patient back up, and then you're gonna take a look at their feet. So this is where you're gonna be checking for edema. Yeah, look at their toes and their toenails, similar to how you looked at their fingernails earlier. Then I'm gonna check for some capillary refill. I'm gonna check for temperature. And then I'm gonna go ahead and feel for my pulses. Here and here. Okay. And then the very last thing I'm gonna do, and this is a little harder to do with a mannequin, so I'm just gonna talk through it, is I'm gonna sit them up on the edge of the bed and use my stethoscope to test their patellar reflex. Sometimes it can be hard to get it, so you want them to kind of pull on their hands. So I've concluded my head to toe assessment. So I'm gonna check for pain one more time. I'm going to ask my patient if they have any questions or any other needs at this time. I'm gonna make sure the bed is low level and blocked with side rails raised, the call light is within reach, the area is free of clutter and debris, and I'm gonna take my gloves off, perform my hand hygiene, and leave the room.